Presented by the Common Sense Institute, welcome to Common Sense Digest, the podcast that seeks to inject a little common sense into Arizona's policy discussion. Here's your host, Earl Wright.
Welcome to the Common Sense Digest podcast. My name is Earl Wright, and I am the chairman of the board of the Common Sense Institute and your host. Homelessness is a hot topic in Arizona. Despite the many efforts to reduce the problem, Arizona saw the highest population of homeless people to date in 2023. Now it is the focus of recent legislation and funding efforts in Arizona. Tom Simplot is here to talk with me about the role of the state and nonprofit and the role nonprofits play in addressing homelessness in Arizona. Mr. Simplot was the director of the Arizona Department of Housing from 2021 until 2023. He served as a Phoenix City councilman from 2003 until 2013, and additionally served as president of the Arizona Multi-Housing Association. Tom, it's great to have you on today.
Thank you, Earl. It's a pleasure to be here. This is a great conversation to have.
Well, let's get started. The Common Sense Institute recently released a report on the spending dedicated to homelessness in Arizona. How much is spent on this issue, and who's funding it? I found this rather interesting.
Well, first, let me say that I really enjoyed reading the Common Sense Institute report. It was very enlightening. For me, it confirmed, I think, a few items that many of us had presumed would be the case, and it was interesting to see the data presented in such a way that those questions were answered for me personally. And so with regard to your question, Earl, even as the report indicates, more than $1 billion is spent in Arizona on homelessness, services, housing, shelters. About a quarter of that is from the federal government. The rest is from the state, county, and city level. But you know, Earl, there's an interesting twist to that. Even though 1/4 of that funding comes from the federal government, we also know this, that once it gets siphoned through our state, county, and city governments, suddenly it becomes local funding, but the genesis is from the federal government. A lot of that is from the federal government. So interesting numbers, but a lot of money is being spent on this issue in Arizona.
The study also talked about the breadth of support. I want to refer to it as the kind of the welfare industry that might be evolving. You have 167 nonprofits providing services to the homeless population in Arizona. That's a lot of companies or entities, and that population has been growing. Most of the focus of these nonprofits has been in sheltering them and providing housing. Even though homelessness appears to be getting worse, is this just a financial issue, or there's something else contributing to this? Is there a disconnect? What's going on?
Well, first, I think it is fair to acknowledge that Arizona has an astronomical growth rate. It has an incredible growth pattern. With that growth pattern, we find that in addition to growth in jobs, that of course we have folks moving to Arizona who may not be equipped to actually land on their feet. But having said that, what are the contributing causes? First and foremost, Earl, from my perspective, we need housing. I was the director of housing. We need housing. Arizona's roughly 270,000 units short and losing units every year, like every state, every locality does from attrition. Housing ages out of use. So not only are we losing housing, we're not building enough housing to keep up with the current demand, and we have growth on top of that. But your specific question, Earl, was why are we increasing in homelessness, and yet we've added so many permanent supportive housing units? And that's a fair question. Clearly, the housing is not keeping up with the demand across the spectrum, including in the homeless demographic.
Well, I want to push back a little bit on that, not to argue with you, but more to understand it. Okay, there's a housing shortage. And is it because you just aren't building the the houses that people can afford, or is it people can't afford houses and thus they've got to find some place to live and they can't afford to live someplace? And so you have a shortage of providing for people that can't afford to rent or can't afford to own something. What are we talking about here? You talk about housing shortage, unaffordable housing?
Across the spectrum, we have a housing shortage. And let's talk about the history of how we got here, because Earl, I think that's just so important that we always take that into consideration. So back in the 80s, when I first started in the housing industry, Arizona, and I think Arizona is probably similar to many states and areas, it was kind of a waterfall effect. The new housing, Class A housing, that was the luxury or the high-end market. As those aged, they became, say, B minus, B, C plus, C minus, D, and so on and so forth, until they, without any government subsidies, became the affordable housing for the low and extremely low income populations. You know, Earl, that doesn't exist anymore. That simply doesn't exist anymore. Nowadays, and this has been the case now for many, many years, if affordable housing is going to be created, it's not from the stock that exists. It is primarily from new stock that is funded primarily from federal and state governments. And that's through low-income housing tax credits, grants, and loans. And it's expensive housing, Earl. That is the most expensive housing out there. And it's a system that doesn't work for our most needy populations, because we can't build enough of it because it is so expensive.
If it's so expensive and we don't have enough of it, what are we thinking that maybe would be a way for Arizona to approach this that would be Arizona's answer?
Well, Earl, one of the challenges we have to building more housing stock across the board is local municipalities. Zoning laws prevent the expedient construction of housing. And that's not an Arizona alone issue. That is across the country. And that's why we see so many state legislators, including in Arizona, by the way, right now, introducing bills that would force local cities and towns, counties, cities and towns, to expedite affordable housing construction. And you know, Earl, this is one of the biggest problems. Unlike market rate housing, when it's light tech or subsidized housing, there is a cap on the amount of rent that can be charged. When that happens, that cost of construction, you can't get any more rent to cover that cost of construction. And if cities and towns, and they're doing this, if cities and towns put in such a lengthy process to get your building permits, to get your zoning, to get your building permits, to get your approval from the community, and then of course don't forget design standards, Earl. Every apartment, every home you see goes through stringent design standards across the country now. All of those have a price tag. And that is what is driving up the cost of housing across the country, including Arizona.
You know, one of the tragedies with regards to homelessness, and you mentioned you've got 14,200 is the estimated homeless people in Arizona, and Maricopa County is the largest group of homelessness is the drug, the death rate from drug overdose, the drug usage. I was shocked to see that of the deaths, I know I'm going to misquote this, but it's approximately correct. 80% of the deaths of the homelessness are associated with drug or drug related, and the fentanyl deaths are really quite high. Give us a sense of what do you think the answer might be, or how do you view that, and how does the state of Arizona view it as far as the issue, and what, if anything, are they thinking about doing?
Well, and again, Earl, for me, I think we have to go back to the history of how we got here, what has occurred over the past couple of decades. And throughout the report, they talk about housing first, permanent supportive housing and housing first. And you know, Earl, back in the early 2000s, the late 90s and the early 2000s, housing first was this new idea. And the report talks about the last 15 years, the explosion of housing first. And I believe the report is very accurate when the authors say that the federal government has pushed the housing first initiative. But what's sad, and of course we see this time and again, government has a one size fits all, right? Housing First doesn't work across the board. It is one piece of the puzzle, one part of that continuum, one part of that spectrum, and it has been taken out of context and used as the answer to the overall homeless problem. And Earl, not only I think you and I both agree to this, but the report would clearly back us up. Housing First can't be the answer. It can't be the answer. It may be one answer in a micro situation that may help one population. But when we're looking at the homeless, and Earl, like you said, when we're looking at the cause of death and the drugs, Housing First, as you know, and as the report clearly states, Housing First is all about providing that roof over the head of that individual or family. Later, they will encourage rehabilitation, job training, and all of that. That doesn't work for everyone out there, and we know this. And so, if anything, I would suggest that what the report clearly indicates is we need to break the mold at this point and go back to looking at other solutions, knowing that there isn't simply one solution for any demographic.
I know that the report also says that the youth unemployment has gone down slightly, but still it's a pretty high number relative to the total. So it's a little over 10%, people under 18 years of age that are homeless. But when you take all of this into account, we're talking about a $20,000 to $47,000 per person cost for Arizonans to have the homeless folks. Is there a smarter way to spend the money? I know you said there's got to be different alternative answers, but are you seeing people suggest that, hey, wait a minute, there's another way we can maybe spend this money a little smarter? And I don't mean to put you on the spot, but have you had that conversation?
Absolutely. Absolutely, Earl. And I can even give you a couple of examples of what I think are excellent examples of possible solutions. But again, one size doesn't fit all. And so I'm going to go down.
Appreciate that.
Yeah. And so there is a campus in Tucson funded by private dollars called the Center of Hope. And it is, I think, one of the best examples if your intent is really to help people get back into a productive and full life. That would be one to look at. The Center of Hope has several different nonprofits working out of that campus. One of which is the Gospel Rescue Mission. So another one is La Frontera. They have shelter housing. They have transitional housing. They have permanent supportive housing. They have housing for singles. They have housing for families. But you know what the common thread is, Earl? No drugs, no alcohol on that campus. You don't enter that campus unless you as an individual are committed to starting that road to recovery. And everything is there, from job training to housing to childcare to education. It is an amazing example. Now, is that replicable? I can't imagine why not. But we haven't seen much like that. And so I really encourage our listeners to go to research the Center of Hope in Tucson and learn a little bit more about it, because I really do think it's a good example of what can be done when a community comes together and makes that commitment.
Let's go down to the State House for a second. You just put forth an example of a group that's gotten together that is getting some good results, and they're addressing the issue in a pretty doggone positive way. Let's go down to the State House. What at the State House level is maybe in your mind could be considered maybe more housing, but beyond housing? Is there anything that the State House is looking at? I know that the federal funds have to go towards housing. I understand that, and at least that's what we've been told in the report, and told that I've heard that in other places. But state funds don't have to. State funds can be used in a way that would treat the issue of drug addiction and other, job training. Are you aware of what the State House may be supporting and what the legislature may be thinking about?
I have not seen any bills that have survived the process so far that would have a meaningful impact on this situation right now. We know that cities and towns are trying to be very creative to their credit. I am not a believer philosophically that an issue like this is best resolved a state level agency or department.
Oh, so you're arguing that keep it at the local issue because the people are more inclined to personalize it?
I would add something, and that is what we don't have today, and that is transparency about results. We don't have any metrics built into the current system. So as you mentioned, 160 plus organizations, nonprofits, well-meaning nonprofits. Think about this, Earl. Every one of those organizations has their own CEO, their own administrator, their own caseworkers, their own fundraisers, and most of their funding comes from the federal government or the state government. So where do we have those metrics that require results? It has to be a result-driven process, like any industry. If somebody goes into the hospital and they walk right back out and they're still sick, well, that's a failure. We should be looking at homeless services in the same way. And if our current services and our housing models are not providing that, then it is time, if the state is going to perhaps take any role, it's time for the state to take another look at this and demand that there be metrics and accountability built into any funding that is received.
Are you maybe making the case that if we're a philanthropic organization and we are supporting efforts to correct the issue, that we too say, hey, let me see the results you've got, and if you can get them, that's great. If you're not getting them, I've got to take my money and put it someplace where I can see results because this is such a significant issue for our state. Or am I overreading that?
I don't think you are at all, Earl. I think where we're going in the future is we've seen the proliferation of nonprofit organizations, well-meaning organizations who have taken the money and done what they thought was a good thing, but they haven't given us the results we need for those individuals and those families. So perhaps, Earl, in the future, what we may see is an industry that will start becoming more limited, and perhaps we will see them consolidate. I think that's probably a good thing. I think we will see metrics, I hope, and we will see accountability. We see that in some organizations today, but it's not the norm. And we need to see more of that. And Earl, one last thing on that line, because I'm afraid I'm going to forget it. With so many organizations out there duplicating efforts, I will tell you, Earl, from my own experience, I know that they compete, and they're oftentimes competing against each other to the point where they harm the actual people they're meaning to serve.
Oh, I'm so sorry to hear that. One of the issues in the report was public safety, and I was really quite surprised that the issues of public safety is like 2.3% of an issue in the general public as far as issues with regards to what would be falling under violating public safety, but it's as high as a quarter amongst the population of the homelessness, where they have the issues of lacking public safety for a quarter of the population. I was astonished. Is this a matter where maybe the police don't have a chance to be as interactive with the homeless population, or do you have any insight what's going on?
I think you nailed it on the head, Earl. The police, I believe, from my perspective and from my experience serving on the Phoenix City Council, I do believe the police are now hesitant to do policing of a large part of the homeless population for fear that there will be backlash. Because we now have the culture where instead of going in and out of jail, and I'm not disparaging this, the goal is to find services for these people. There simply aren't enough services. So instead, what is the police officer to do? There's a crime. You need to arrest for the crime. Clearly, there are deeper issues going on. And you mentioned the drug addiction earlier. And going in and out of jail isn't going to solve a drug problem. I agree with that. So is the answer more services for behavioral health? Probably. What does that look like? And do we have the organizations existing today to be able to do that? I'm not sure we do. Not to the extent that we can meet the needs of the growing homeless population in Arizona.
I was surprised. I don't even know how the study got the data, where they said, and I believe it's correct, 78% of the people that they talked to to ask this question said of homelessness people that they had some emotional issue. And I'm thinking, my gosh, that's just a cry for help. As you said before, it seems to me that if we can find the people at the local level that can help them out. But are you seeing anything that is special, trying to handle that in a special way?
I do. There are several behavioral health organizations in Arizona who are now stepping up to accept the responsibility for housing as well. And they've done it out of necessity because they've realized with their behavioral health clientele, there's no place to house them anymore. Very few landlords will accept a voucher for somebody out of the behavioral health services system. And if they have coupled that with self-medication in the form of addiction, drug, and alcohol abuse, and if there's violence and a record of that, there are very few options out there for folks. So I am hopeful that we will see growth in that effort by our behavioral health organizations. In the past, healthcare was healthcare, housing was housing, and the two never spoke because they just weren't connected. And sometimes they're not allowed to be connected. In Arizona, Arizona is unique. There's actually a waiver of some Medicaid laws that allow a healthcare provider to actually provide for housing now. Never before could that work. But Arizona is one of the few states that can actually do that. So we're almost like a test tube of what we could start to look at and how we can design a better system that would meet the needs of that population.
That's impressive. Well, I think that leads to kind of a concluding question here. With the legislature just kind of getting started, getting kicked off, if you were the omniscient, benevolent dictator that could say, hey, we need to do this, what would maybe the two or three things, if there are two or three, you would suggest the legislature take a look at to help get a resolution of this issue?
Well, as we started out the conversation, Earl, I believe it all begins with housing. You got to have some place for people to live. And then you have to have the services for those that need the services. So if we're talking about what would I do, I would immediately put in some sort of escape hatch, some sort of by right zoning, so that if you're a church and your mission is to provide housing for those in need, you should not have to spend up to 24 months or longer to get zoning approval and site approval to build affordable housing and perhaps permanent supportive housing on your church site. That should be by right zoning. Or there should be by right zoning for an old Kmart store that's sitting on 15 acres of blacktop parking. Well, that was maybe a great concept in the 70s, but I think we've evolved from that. And there are so many opportunities throughout metropolitan areas where we can build on vacant land that's been improved to the extent that it has water, sewer, electrical, and all of the things we need to build housing. We just now need to get on with it and build that housing. And then lastly, provide those opportunities, provide those incentives for our behavioral health organizations to continue to explore how they can build, develop, and manage housing that will serve the needs of their behavioral health clientele, which, again, are many times the homeless population.
Well, I think that's a pretty good checklist for our Arizona legislators to take a look at and noodle over and see what can be done to help these 14,000 people, at least currently 14,000 people, that many of whom have emotional difficulties and most of whom have drug issues. And Tom, thank you so much for what you're doing and leading the thought effort with regards to Arizona, the housing and the homeless issue. We appreciate your time today.
Thank you, Earl. I appreciated talking with you today.
Thank you for listening to the Common Sense Digest. For more on today's topic, as well as our research on the most pressing public policy issues facing Arizona, please visit commonsenseinstituteac.org. The preceding episode, along with all others, is available on podcatchers everywhere or on our website under the podcast tab. Our technical producer is John Ekstrom and Deft Communications. This has been a production of the Common Sense Institute.